everybody. It's wonderful to be here, and I would like to thank the organizers for having invited me in this beautiful country. Yes, I'm going to talk about the health claim regulations worldwide, because health claim regulations is actually the framework that has been established and that is determining what can be said about food in terms of health. If you do not fit within this framework, then unfortunately you will not be able to communicate about foods if you are a food business. And this is a very important thing to recognize. Yeah. We at EAS Strategies in Brussels, we are a consultancy company in food law, and our 25 staff people in our offices in Singapore, in Buenos Aires, in Moscow, and in Brussels have a long-standing experience with helping governments, helping companies, helping trade associations understand the regulatory environment in the world. And you will see after my presentation probably that there is a very big difference between the regulatory systems all over the world, between the countries. I'm going to focus largely on Asia, because that was the focus of my presentation. But I'm also going to give you some experience from a number of other countries that have put health claims regulations in place over the years. And some of these systems date back from the 1990s, and you will see they have considerably evolved. They are still evolving. I'm not going to talk about the situation here in New Zealand. I know that the health claims legislation has come into application beginning of this year. So this is a very good evolution that can help the industry in New Zealand very much in understanding claims and help them to make claims within the regulatory framework. But it is the start of a whole process that already has been taken place in the other countries with a long-term experience. If you look at regulations, everybody, at least in the scientific world, talks about functional foods. Now, functional foods was a concept that was developed and defined in the early 1990s, and yeah, is actually a concept that illustrates that food can have an effect on health, but you will nowhere find that term in legislation. So there is no legislation about functional foods, which means that there is already a disconnect between how regulators see the scientific basis of food science and scientists see it. There are a lot of regulations in place, and they are always based on definitions of claims. So the regulators have focused on different types of claims, which is, in my view, a bit silly, because actually you will see, and I hope that I can show you, that there is actually very little difference between all these types of claims when it comes to the scientific justification. Another element is that a lot of the developments in the world have been pushed by the dietary food sector. Food supplements, dietary food supplements have, of course, because of their nature, they need claims. If you do not have a claim on the effect of the product, you really have no product. And so that sector has been very instrumental in pushing developments at national level in order to create frameworks to regulate claims. And therefore you will see that in some countries there are different systems in place for conventional foods and for food supplements. There are countries where you have both covered, like in the EU. There is no difference whatsoever between a conventional food and a food supplement when it comes to claims. But in the US, for instance, you have different rules. In ASEAN, the collaboration of the 10 Southeast Asian countries, it's only applicable to dietary supplements. Well, it's called health supplements there. And in China, actually, it's not conventional foods, it's not dietary supplements, it's just a category that has been created, which covers both, which is called health foods. And dietetic foods are separated separately. Now, why do I mention dietetic foods? It's because if we are talking about health benefits, we are talking of improving health, but we're also talking about people that do not really are in optimal health. And that is very close to dietetic foods. Now, definitions of health claims differ everywhere. But there is one organization at international level that leads the way to international standards, and that is Codex Alimentarius. It's a body that is jointly managed by the WHO and the FAO, and they develop international food standards. And they have developed definitions of different claims that actually should be the standard globally. There are three types of claims that they recognize, three types of health claims. It's nutrient function claims, which actually is the normal functions of nutrients, of vitamins, of minerals, of essential fatty acids. That is covered by nutrient function claims. But you also have other function claims, which means these are claims that relate to a health effect of a non-nutritional substance. So many of the substances that we find in our diet that are not nutritional, like probiotics, like antioxidants, like bioactive compounds that you find in foods and in plants. And then you have the third category, which is called the reduction of disease risk claims, which actually refer to a claim stating that the intake of a certain food component can reduce the risk of a certain disease. And then we are, of course, talking or thinking mostly about non-communicable diseases like obesity, overweight, cancer, cardiovascular disease, hypertension, and so on. These are the definitions that should apply globally, but they are interpreted pretty much differently in all countries. And they are also quite limited. You will hear a lot about science during this symposium, science in different areas of food. I would ask you to think about any example that you will see and think whether it fits within one of these three categories. Because if it does not fit, if the health benefit that is being investigated does not fit in one of these three categories, then you can pretty much forget about it. You can pretty much forget that this is ever going to be something that can be communicated for foods by companies. And that is very important because we have already seen these advances in science in the previous speakers have highlighted. The legislation is by far not ready to cope with that. Legislation always lags behind 10 years after innovative science. And that is a very important aspect to remember, because that is going to be a factor that is going to limit the interest that companies will have in innovation, because the leeway from start to end result is simply by far too long. Also, this is something that is interpreted differently in the member states, and like for instance in the European Union. Reduction of disease risk claims, as they are being proposed by Codex and as they are in place in other jurisdictions, are simply impossible, because the legislation has curtailed them. They have to refer to a risk factor. So that means already that you will never have the possibility in the European Union to communicate on a health benefit for those diseases where you do not have identified a risk factor. Leave alone that you will be able to do that if you have identified a risk factor, but you cannot really identify the effect of the food component on that risk factor. So it is really a very tight, strict, very narrow framework that regulators have put in place in order to allow claims. Now, claims, regulations across the countries is a fairly recent development in most countries. There are only a few countries where they have quite long-standing experience. It's the United States, it's Japan, Codex a little bit, and then the EU since 10 years. But all the other countries have actually started later than that. And they are looking of course, at systems that are in place in those countries with advanced systems. I will show you that such systems evolve over time. They are not cast in stone, and they are actually being accommodated to become more pragmatic because the experience shows that it is not always working what the regulators had in mind. And that means also that you will have these differences between the countries that are simply irreconcilable between each other, which means that you will have systems in place at a certain stage of their development, yeah, that allow claims or allow practices that will simply not be possible in those countries where you have another stage of the process. And that means that harmonization of health claims across the globe is still far from a reality. This is an example of ASEAN. You see the three types of claims that have been accepted, well, that are under discussion, because actually this system, which I have already indicated, only applies to health supplements, does not apply to conventional foods. This system elaborates a number of definitions. You see already here that there are differences with the codex definition, because some of the claims go a bit broader, like for instance the function claims relate really also to improving the feeling of health, also relate to science, which was not actually accommodated in the codex standard. So this shows that when discussions start to take place between countries, that you get two new concepts, because simply you have different experience in the different countries. What systems are in place? Well, you have very many different systems. You have systems that are largely based on pre-market authorization. Pre-market authorization of the product, for instance, like in China, or pre-market authorization of the claim, like in the United States, in Europe, certain claims in Japan, in South Korea. You also have systems that are based on lists of claims. So you have a list on the claim, you can use it, and that means that there is no need for a further application. You have systems that are based actually on more general requirements and notification, and where the responsibility for making a claim is actually put onto the companies, in the same way as responsibility for safety is put on the companies. And you also have claims where you do not need pre-market authorization at all. And you see from this overview that even in one country, several systems can apply in parallel, depending on the type of claim and depending on the type of product. Also, the scientific principles differ. I think the European Union has by far the most thorough assessment of claims. And you will only get approval of a claim when the evidence underpinning the claim is conclusive, is generally accepted without any doubt. In the United States, it's a little bit different. It's pretty much the same in terms of the need for scientific agreement, but there is a more wide assessment of the science because of the fact that the legislation covers more health benefits relating to disease reduction, not disease risk factor reduction like in the EU. And you also have possibilities to use authoritative statements in a number of countries, which means that you do not need to underpin it with all the individual studies, but that you already can refer to scientists that have drawn the conclusion for you. And then you have qualified health claims, which is a system in place to indicate that if you have not sufficient evidence to be absolutely conclusive, you can still communicate, but you should in your communication also indicate what the level of claims is. These systems all exist, and they even exist in one country. Take, for instance, the United States. The United States started in 1990 with the most thorough system that you could imagine, which was a system that was in place to authorize health claims, and health claims in the United States only means reduction of disease risk claims. Very tough system, but it worked. And the United States tried to impose the same system for function claims. And it didn't succeed because the Congress opposed. Which means that in the United States you have a system of reduction of disease risk claims corresponding with the highest level of science that is needed. And then you have structure function claims, mainly for dietary supplements, that also should respond to scientific criteria, but where the responsibility is simply upon the companies. And so that is a complete gap, a very wide gap between these two systems. But even the system for health claims that the Food and Drug Administration had put in place was not necessarily workable for all claims, and therefore they changed the system, or at least they added in 1997, they added the possibility to use authoritative statements of government bodies as a basis. And in 2003, they were forced to accept qualified health claims because the industry had challenged the FDA before the court in a court case that said that the sole reliance on significant agreement is actually limiting the freedom of speech. And so the FDA should allow also companies to communicate when the health relationship is less substantiated than with scientific agreement. Japan is another example where you had a very strict system in place. It's FOSHU, Foods for Special Health Uses, authorization pre-market-wise of products involving safety and efficacy. The system was so strict that only few companies dared to go into that system and have a claim approved. And so the authorities realized that they had to change that system and make it a bit more easy. And in 2001, they had a system for nutrient function claims, which did no longer require product authorization. In 2005, they simplified it again by the inclusion of a number of categories, and one of these categories is qualified health claims, qualified FOSHU, which means the same concept in the United States, qualified language. And it still did not stimulate the industry to put in a lot of applications. So the system changed fundamentally now, has changed fundamentally towards a notification system of functional claims, where there is no pre-vetting anymore of the claims. In Korea, South Korea, they started with a system and they included that from the start, they included these different systems. They included the system based on a list with 37 health relationships for general functional foods where you do not need to apply for an authorization. And then they have reduction of disease risk products, and they have other function claims where you need to apply for a registration, but where you also have the possibility for qualified language, depending on the grade of evidence of the substantiation. In Europe, you have a very strict system based on conclusive evidence put in place in 2006. The consequence is that, of course, a lot of health benefits that were being claimed under national legislation before did not get through the assessment. Whole sectors were affected, like, for instance, probiotics. There is, until today, no single claim for a probiotic accepted in the European Union. You have also for joint health, the same problem. Antioxidant, the same problem. So you have a very strict system that has curtailed a lot of claims that are possible. And one of the most important categories for these claims were botanicals. And botanicals, used mainly in food supplements, are accepted under medicinal law in the European Union without any proof of efficacy. You only have to demonstrate that the product has traditional use, and that's it. So there was a mismatch between the requirements of food, which were far more strict than for pharmaceuticals, and that led the European Commission to put these claims on hold and to discuss now how to go further. So you see also that in the European Union, that discussion about the level of evidence is a reality and is going to be discussed in the coming years. Level of evidence is also at the core of the ASEAN harmonization, and you see here that depending of the claim, and you have these three claims, you can substantiate the claims on the basis of different level of evidence. So that is going to become applicable in 2017, not for functional foods, not for conventional foods, but it is very likely that it is also going to have an effect on conventional foods. Now, what does this mean for marketing? Well, actually, there are three types of companies that want to make claims. You have companies that market primary products and are simply looking to a new angle to communicate about the health benefits of their products to the consumer. Yeah? These companies look for an opportunity. There are companies that need a claim to make their product make sense, like dietary supplements. And there are those companies, mainly spin-offs of university research, who generally are interested in new health benefits and that are going to initiate research. Now, what are the two first kinds of companies going to do? It's the majority of the market. Well, they are going to do, and they are doing, what any one of us would be doing. It's looking for the most easy way to make a claim. That is not so difficult, because for nutrients, mostly the consumer is already aware of a lot of benefits. So only using a nutrient content claim could be sufficient to convey the message of healthiness to a product. And in any case, there are so many nutrient function claims accepted that you can pick one of the list and use it for a product. You just add the vitamin and the mineral and you can use it. I'll give you an example in my next slide. So that's a very easy way. Other ways that companies have or are using is referring to other messages that are not considered health claims, but still give a certain health image to products. And I've seen in the European Union products being advertised on television, products that had lost a health claim, that are now being perceived to be far stronger linked to health because of the emotional message in the advert than was the case when they could still use the health claim. So science is not always making consumers buying the product. These are some examples from the European list of claims that you can actually make on products if your product contains 15% of the RDA of a certain nutrient. You can see there are quite some strong claims on that. Blood clotting, neurotransmission, for magnesium, for instance, heart function, nerve function, for vitamin C, immune function. You can see collagen, and you can even see claims, this is for zinc, for instance, relating to fertility and reproduction. It's very nice for companies just to pick such a list such a claim from the list. And that is what is being happened. Products like probiotic drinks that have been marketed for immune support and could no longer make that claim, well, they just add vitamin C, 15% of the RDA of vitamin C, and then you can actually say that vitamin C helps maintain or is necessary for immune function. So it's a very easy, and it doesn't cost much to do that. Also, there is a gradient in the strength of the claims. These are some examples of claims that you can make for calcium, going from the very simple contains calcium claim to the medicinal claim that calcium prevents or treats osteoporosis. Going down the list means far stronger claims. Going down the list means also more requirements for scientific justification. But going down the list does not necessarily mean that the claim becomes more appealing to the consumer. And so it is very much possible that you can get across the same message to the consumer by using a very simple and weak claim. And that is why initiatives like the High-Value Nutrition are so important. Because there is in these systems at global level very little incentive for companies to engage into research. Because either it is very easy to make a claim that has already been approved, or the system is so complex and tedious to follow that the company simply doesn't decide to invest in research and go to the procedure because it's more easy not to do. And the system of qualified claims has been introduced in these countries for a number of reasons, and one of the reasons is that it would stimulate innovation because it would enable research already being communicated at a stage that it is not conclusive. And so companies would not need to wait too long to have return of their investment. But it helps, or it works in countries like Japan and Korea, but if you implement it in the same way as the US FDA does, I'm not quite sure it is very nice or very appealing to use by consumers. Like, for instance, these are 3 examples of claims that the FDA has accepted as qualified claims, but if you have to indicate that the FDA concludes that it is highly unlikely that tomatoes reduce the risk of pancreatic cancer in a claim that says that exactly tomatoes are helpful in reducing the risk of pancreatic cancer, then there is very little incentive for companies to use that. Still, consumer research suggests that these claims are perceived by consumers to be stronger than genuine health claims with a thorough scientific backing. Now, I've told you in ASEAN they are harmonizing health supplements. They are not harmonizing conventional foods. So you will still need to assess the situation country by country if you want to export from New Zealand products to the member states of ASEAN and see what is needed. In some countries you will need to register the products, in some countries you won't. In some countries you will be able to claim certain health benefits, in other countries you won't. So there is no magic solution for that. You will have to have the in-depth knowledge of the situation. And secondly, if you do that, if you market products in these countries, you may see that the level of evidence that you have for your product is maybe not the same in all these countries. If you go to China, it becomes even more difficult because China still has a system of pre-market authorization of the product. It's called health food, and that health food can be both a nutritional supplement or a conventional food, but with a health claim. Yeah? That system is being changed, and I will give you some details in the next slide. But what is important is that you cannot claim anything about the food if you are not registered or notified as a health food. And what is also very important is that you will only be able to claim a number of benefits that are already in a list of permitted claims. This is the list of health relationships. Some of them are very strange. Maybe it's translation issues with China, I don't know. But these are 27 claims areas that are acceptable, and the new legislation reduces them to 18. So that means going beyond, outside this is also very difficult. The authorization process is long. It takes 1 to 2 years at least. And what is really very tedious for imported products is that all the studies, whether it is the safety studies or the studies underpinning the health benefit, need to be carried out in China. If that is not the case, then it is far more difficult and you risk a rejection of your authorization. So it is a very protectionist system that is in place and that favors very much the own domestic food industry in China. The new regulations put also far more focus on safety, obviously, because China wants to improve its safety image. It's a large exporter of foods, and at least food supplements, to all parts of the world. So they want to improve their image. And they also want to make it a bit more easy for companies to enter the market by introducing now a notification system for certain products. Notification for products that will be in a list that is to be established, so you would not need to register anymore. And you would also not need to register products that are imported into China and that only contains vitamins and minerals. But you still need the studies in China, and you still need quite some strong certification of GMP for production if you want to enter China. So, to conclude, I hope I have made it very clear that the regulatory situation of claims in the world is very different, and that you really need to know what the situation is, that you need to know that from the start, from where you start with your development of products and health claims, that product classification is very important, because in some countries you are far easier to put a product on the market as a dietary supplement than as a conventional food. And when you are developing functional ingredients, well, you have the choice to incorporate it in a given matrix. So you can, you need to do that because it determines the legal requirements. Also, the type of claim is very important, because the wording of the claim, a change of perhaps one word in the wording of the claim may mean a different procedure, may mean more stringent criteria for authorization. What is also clear is that systems evolve over time, which means that they are adapted to become more pragmatic by changing registration processes into notification processes, by changing strict fixed wording that is conclusive into qualified language. That is a process happens everywhere, but it is a process that takes a long time. Claims are mainly a marketing tool, and that is something that scientists should never forget, because you can do the nicest science on a certain food. If that is not sellable to the consumer, then you will simply not have any use of it in real life in a company. So you should clearly identify what consumers will understand and what consumers are likely to buy. And finally, from a company perspective, if you really want to have a claim strategy in place, consider all these elements from the start. And if you don't know it, please seek expert advice. We have seen a lot of companies coming to us at stages that was far too late in order to, so we saw that they have wasted a lot of money, a lot of resources on things that actually they shouldn't have done because they were simply not aware. Thank you very much for your attention.